Hi class, welcome to chapter 3. I'm actually going to do a mini lecture for you on assessment just because I think it's going to be more helpful than just reading the book. So let's go through the whole process or part of the process of assessments. A psychological assessment, it's a procedure that is really going to give us an idea of how to better treat a client. So remember, unless you are a psychiatrist, unless you are specifically um, helping someone that has specific medical conditions, you are not going to say patient, you are going to say the word client instead. So psychological assessments, we are helping the client figure out, first of all, what the diagnosis is before we can even come up with a treatment or a treatment plan. So we're looking at an individual's cognitive ability, personality traits, and psychosocial functioning. So there are many different types of measurement techniques, and they all involve having a scorable information sheet or key that will really give us insight to how to decode what these tests are supposed to do. So you see, I put 3 pictures here. One comes from a type of intelligence test. The second is not really an intelligence test at all, or any type of test. It's just going to show what parts of psychological functioning we're testing. And the last one, which is an ink blot. You might have heard of Rorschach's ink blot test. This is a sample of one of those ink blots. What makes a good psychological test? The reason I had you do the definitions of reliability and validity is to really get a gauge of what your understanding of those two terms are. So a lot of you have given some really good examples, and I'll still need to go through and really look at it, but reliability, remember I told you anytime you are going to define a word, you should not be using the word in the definition, right? So you can't say something like something that has reliability is reliable, right? So instead you would say something like it is consistent, right? What we're looking for in a test, if we say we're looking for reliability, that means it's going to give us similar results at any point in time that person takes it, right? So let's say that an example would be if you are taking the SATs, right? I mean, you have taken the SATs, which, there's a lot of scandalous things going on with that, but you know that it is actually pretty reliable because you can score the same score or very similar scores, whether it is, I don't know what the scores are these days. When I took the SATs, it was out of like 2,400. But if you are scoring something like 1,200 and then you score something like 1,250, and then the next time you score 1,190, those are pretty consistent numbers, right? And if you have a friend who, you know who I'm talking about, that friend that you have to tell them that, hey, dinner is at 5:30 when it really starts at 7 p.m. You know that friend? Why do you tell them that dinner starts at 5:30 when it really starts at 7? Because they're late, right? Because they're always late. So if we're talking about if they're reliable, are they reliable? Yes, actually, they are reliable because they are always late. That's reliability. We're looking at consistency. So um, validity has to do with, is it an accurate measure, right? So if we're using that example of the SATs again, we are looking at the SATs are meant to give us a more clear indicator of academic success in college, right? That's actually what it's really supposed to be for. However, it doesn't really prove academic success. A better indicator is actually GPA, right? So um, academic, knowing a person's ability to uh, work in an academic setting throughout a semester or throughout a year, that gives us a better indicator because that grade point average has to do with their academic performance over the course of that class in the semester or term, right? So validity is really, is it measuring what it's supposed to measure? And the SATs do not accurately give us the measure of what it's supposed to measure, which is collegiate academic success. Reliable, yes. Valid, no. So that's why a lot of colleges are trying to get rid of that whole process. It's really the only test out there that is that was required. We still don't know what's going to go on with that. Hopefully it goes away, but we know now that it's mainly a business, and the reason they're trying to fight so hard for it is because that business has been making so much money for the last decades, right? Standardization is a new term that I didn't have you look up, but this is important to psychological testing because we need to have clear instructions and scoring information. So things like if you remember the SBAC or Common Core, whatever those things are called these days, for me it was called STAR testing. Even the SATs, yes, those are still actually standard or standardized because you have very specific rules. Everyone is trained to be giving those tests in the same way. So whether you are taking the SATs in California versus New Jersey, it's supposed to be given in the exact same way and scored the exact same way. Let's talk about evidence-based assessment. Evidence-based assessment, this is making sure that the best assessment methods possible are used. And clinicians, we have to make sure that we are adhering to principles of evidence-based assessment, which include one, relying on research findings and scientifically viable theories. So again, not just making an assumption and shooting in the dark, right? We're really trying to target what the diagnosis is. Now, remember that labels aren't very good because of the stigma that comes with it, as well as if you are only looking for treating one type of disease, you might miss all the other diseases that it could possibly be. So we want to make sure that first we get the right one, but also we're making sure to use the best treatments possible for that specific diagnosis. Second, using psychometrically strong measures. This is making sure that it is reliable, valid, and standardized. We have come to kind of like a full circle where there's still a lot of belief in, um, even different articles you see out there about different types of testing, different types of, a lot of people have asked me this in class, what about LSD testing or using MDMA? There is evidence for that, but I have to really, really stress the importance that usually in those types of clinics where the last I checked, only there's really only one, and it's not even the United States that does the MDMA testing. And when they talk about microdosing, they're making it's not going to be a pleasant experience, right? It does work, but the amounts that the clinicians are using is such a small amount that it makes you go through those feelings that are causing you to kind of have these types of episodes for whatever it is that they're trying to treat, whether it's depression or PTSD. So it's not like the person is getting a high or going into a drug-induced state where they're, partying. It has more to do with they're facing the difficulties that has caused them to have these types of episodes anyways. So when you hear anecdotes from people and testimonies from people who have gone through that treatment, they'll tell you, yes, it changed their life, but they'll also tell you that it was the most excruciating type of therapy that they had to go through in order to come out the way that they are now, right? So 3, empirically evaluating the assessment process. Again, those types of studies, we'll use the same example, the LSD and the MDMA studies. It is specifically done in a way that they're making sure they're taking notes, they're objectively measuring rather than just giving them drugs and or having them go through the process on their own. So we make sure to evaluate the assessment process. Next is the last one, which is number 4. So when interpreting test results, we need to ensure that they don't fall into the Barnum effect. If you have never heard of Barnum and Bailey, right, so that is a very, very famous circus that used to travel around the United States. I'm not sure if they traveled around the world, but maybe. But Barnum effect has to do with Anybody in here? Let's say, let's pretend that we were in face-to-face class and I pointed out and asked you, have you been feeling stressed in the past week? Right? And then you say yes. Have you been feeling very tired or lethargic in the past, 12 hours? Have you been feeling, thoughts of insecurity and what's going to happen next, right? Have you been having mood swings? And I could go around the room pointing at a lot of different people, and then I could say, wow, that's great. I could point to a biological male and say, those are symptoms of pregnancy. It looks like you're pregnant, right? So that is the Barnum effect. It's kind of like looking at horoscopes. And, if you like horoscopes and you like reading astrology, that's totally fine. Again, your beliefs are all your own, but a lot of them are so vague that, and I know that some people will argue with me and say that there's some that are very specific. Okay, let's not argue. This is kind of nice. This is kind of nice not arguing, but um, a lot of those statements are so vague that you're going to say, that is me. Oh my gosh, this is so accurate, right? When we are using psychological assessments, we want to make sure that it's not because it's so vague and people don't fall into the Barnum effect. All right, so let's talk about the clinical interview. I don't know why at the bottom of this it says too quiet. I hope that you can hear me. I'll go over this when I'm making the captions, but hopefully you can hear me. And the clinical interview is the first step in any intake process. This is very important for you to pay attention to and for you to rewatch more towards this middle and end of the semester, because your project, your final paper, is actually going to be based off of an intake process, the whole process, actually, a whole diagnosis process, including treatment, which we'll talk about later. So anytime you have a client, whether it is for private practice or in a hospital setting or in any type of treatment center, like the ones that you learned about in the last chapter, any types of places of treatment, you have to do a clinical interview. It is the first step before coming up with any assessments. This will help you to choose the type of assessments you want to use, but it itself comes first, right? So before you even think about treatment or what the client could possibly have, unless you're at a specific center where somebody sends them to you or refers them to you for that. But anyways, you still do a clinical interview. So there are different ways of doing a clinical interview, and I'm going to talk about why you might choose one over another. So the first that we talk about is this unstructured interview. It involves a series of open-ended questions. So I've had students and clients tell me this before, where they're like, I went to try to talk to a counselor, I went to a therapist, and I hated it. I did not want to go back. I'll give you some more examples, but let me tell you what this is first. Okay, so an unstructured interview, open-ended questions are, so Jojo, what brings you in today? And then Jojo tells me all the things that brings Jojo in today, right? So they get to talk about what it is that is actually on their mind, and we work with it from there. So here we are looking for reasons of being in treatment, whether you were referred or not, whether you came on your own, whether it was because your boss told you you needed to go, get counseling, whatever it may be. Symptoms, these are what you're feeling, right? So if you're feeling like, nothing's really wrong, but nothing's ever really good, that could be a symptom, right? I have been feeling really tired. I have headaches. I have, like these things that are on my mind. I can't sleep at night. I get really nervous. I have racing thoughts. Those are symptoms. Those are the types of things that you could report when you come see a clinician in an interview. Throughout my slides, when I do the lectures like this, I will shorthand write SXS, like how you see right next to symptoms, and that's just a short way if you're taking notes with, the traditional paper pen way, or even if you wanted to type it out. So just know that SXS always means symptoms in this class. Health status. It is always really important to know what physically you're going through as well, whether it is an injury, whether it has to do with sickness, like having the flu or having COVID, right? Anything like that. We want to know about what your physical health status is as well. We want to know about family background if possible. So even if you are adopted, we want to know that if within your family, your adopted family, whether you have different types of psychological ailments that are going on in your family, right? Whether you know your biological family or not. Life history, also very important. And these are things that it might take you a while to open up and talk about, but the whole point of a clinical interview is to get information, but also building rapport in order to get that information. So unstructured interviews, they're they help build a lot of rapport, but I might not get a whole accurate picture of what's going on because you might think you're coming in talking about your relationship issues with, your brother that you used to get along but you don't anymore. But it might be stemmed from things that are going on at work or at home, right? And if it's open-ended and I don't go through specific questions and ask you, I might be missing a huge chunk of what could possibly be a potential cause of the reason for being in treatment or the reason for coming into treatment. A structured interview is the one where I get a lot of complaints from students who've told me that they've gone to a clinician, they don't ever want to go back. So this is where there are standardized series of questions with predetermined wording and order. This is to make sure that everyone is treated the same and that I actually get all through all the things I need to ask you about. And I'll show you the structured interview, I think, in a few more slides. But basically, you might come in wanting to talk about relationships, right? That's kind of a big topic in the collegiate demographics. So you might come in and I will say things like, okay, before we start, I have to go through these questions and I'll ask you, do you smoke? How often do you smoke cigarettes? Or do you smoke weed? How often do you smoke weed? Do you drink alcohol? How often do you drink alcohol? Right? What's your occupation? How long have you had this job? Or if you don't have a job, what's the reason for unemployment? Right? Are there any legal histories? Do you have any medical histories? And a lot of people will say they kept asking about all these different things, but I came in wanting to talk about my relationships, and that was what was really bothering me. And that's where some clinicians, if you're very, very new, you will lose rapport, and then that client doesn't want to come back to you. So what I tell my students is go back and give them another shot or find another clinician that would work better with you, right? So a lot of people don't tell you this, but it normally takes about 4 or 5 times before you find the clinician that you're really going to trust and have that rapport with. But if you find if you find that person on the first try, that's great. If it takes 3 tries, that's great too. But not all therapy is the same, and not all clinicians are going to tell you what their background is because they don't think that it's important for you to know. So one person in this class actually mentioned talking about in your discussions, talking about wanting to know more about psychoanalytic types of doing therapy. That's very Freudian, if you remember from 101. And for Freud, he was more, everything is sex in your mom. I've had clients tell me this before. I've had students tell me this before. Yeah, I was totally turned off because they kept asking about, what's your relationship with your mom? How did she treat you when you were younger? And they kept referring back to that, and they'll say like, no, my relationship with my mom is great. Like we're fine. I love my mom. We're awesome. And that's a psychoanalytic type of way of doing therapy. And that works for some people. That actually a lot of people, not a lot, but there are people who do well with in those types of therapies. And then you have me, who's more of a behaviorist, cognitive behavioral um, therapist type of background, and I'll go in and ask you more about, I don't really care about what happened in your childhood. I just need to know about this behavior that you want to fix and what happens right before that behavior, right? So if it's like something like smoking cigarettes and you're like, I don't know, just I can't I can't shake the habit, it's just too difficult. And I'm like, okay, well, what happens every time right before you reach for a cigarette? What happens right before that? So not what happened in your childhood, not what happened when you were, going through puberty, but what happens right before you want to reach for that cigarette, right? So that is more, that's a different type of therapy, right? And there's lots more than just psychodynamic and cognitive behavioral therapy. All right, so structured interviews, if done right and done in a way where we're really prepping you to know that I have to go through all these questions first, it will really work out. Now, there are some people who like the semi-structured way, and this is really good for experienced clinicians. So I will say something like, okay, I want to know your reason for coming to see me, but there's all these questions that I do need to get through too. Now, a normal clinical interview takes between 50 and 55 minutes. If that's not enough time, your intake process could be over 3 different sessions, and this is usually the case for private practice. If it's something where I'm working with a child or I have to go into the field, I won't do a clinical interview first. I'll actually go and observe, but eventually I will do the interview. But it's likely they're being referred to me for a very specific type of disorder or types of disorders where um, I'm getting that referral from. Anyways, so semi-structured is best for experienced clinicians. All right, so what is covered? All of these are very important, and if this is bringing back any memories of you having gone to an intake process and they didn't explain this to you, technically they don't really have to explain this to you because it is a short amount of time. 50 minutes seems like a long time, but this is for your whole entire life for me to figure out, right? So, and it might be that you don't feel comfortable with that particular clinician, so it takes you maybe 35 minutes to open up in the beginning, right? At first, maybe you're not really talking at all. And it could be that you just don't open up until maybe that third session, right? So I have a lot of ground to cover. So here I need to know your age and your biological sex. And then if you want to tell me about preferred gender, that's great too. And we'll talk about all of that throughout your clinical interview. But it's very important for me to know about your age and sex, because if you come in saying that I am a 13-year-old female and I'm feeling things like, mood swings and this and that, all these different symptoms, your age and sex will help me know more about that. But if you're coming in and giving me symptoms saying that you are a 56-year-old male, then this gives me different types of information, right? Because typically if you're 13 and female with certain types of symptoms like that, mood swings, it's puberty, right? So it could be something like that. Whereas for a male, it could be something, a 56-year-old male, it could be a different cause altogether. Probably not puberty, right? Definitely not puberty, I should say. Okay, so other things are reason for referral. It could be, again, it might take forever for somebody to open up just because the reason for referral is they don't even want to be there. They're doing counseling because their spouse is pushing them into doing it. They're doing it because of academic probation, and they don't think that there's anything wrong. So I need to know your reason for referral. I need to know education and work history, because it makes a difference if I hear information like you have every 2 weeks you're at a new job, right? You can't stay at a job for more than 2 weeks and you've been employed at 13 different places in the last year, right? So that's something that is important for me. Or you've been in the same job for the last 23 years, and that is important for me to know too, right? It's important for me to know that maybe you didn't finish high school, but you got your GED and now you're in college. That shows me a lot of information. It shows me that even though you didn't go through K through 12, you still had a different motivation and you got here in a different type of way, right? So that's information that's important too. Or you've I know people like this, and you've been in school and you're planning on being in school for your whole life. So I know an individual who, this was when I was doing my master's program, and he was on his third master's, and he was like, I'm just going to keep doing school forever. And I was like, oh, okay. He wasn't in the psych department. He was actually in the business department. So that was cool. But right, so that gives me information too. So all of this information I won't know unless I ask you specifically about it, right? Because a lot of the times people forget, they don't even think about this might being something that's important for me to know. But it is. All of this could very well be. Current social situation. So this is where I find out if you are currently in any type of relationship, um, married, single, widowed, divorced, right? These are all important pieces of information for me. And physical and mental health history, right? So again, I need to know if physically maybe you are on certain types of medications for, um, for high blood pressure or for whatever it might be. This is important for me to know too, because pharmaceuticals all have side effects. So it might be that a reason for you seeking treatment is one of those side effects. Drug, alcohol use, and current medication, right? So I need to know, you might have been asked, how much caffeine do you drink? And I'll tell you right now that I'm on my fifth cup for the day, but that is okay. I am actually pretty sensitive to caffeine, so this is why I'm talking a little bit faster than usual. Okay, so again, list of medications in order to avoid potential interactions. All right, so family history. So you might not be able to find a lot of family history for some of your clients, and that is okay. That is a piece of the puzzle that would be really nice to know. And I didn't mean to just call a client a puzzle, but if you want to think about an integrated puzzle, that is what we all are. We all have all these different parts of us. So I want to know a little bit about your family history, right? I have a good relationship with my family, and but growing up, it wasn't always like that, right? So that's something that's important to note too. I have an aunt. She lives in another country, but she was never formally diagnosed, but she has, some symptoms of this and that, and my mom told me that taking care of her was a really difficult blah blah blah, whatever it might be, right? That's important to note too. Behavioral observations. Okay, so this is one that you're not going to ask, but you're going to note. So these days, if you're doing counseling or therapy, there's a lot of Skyping or using teleforms of communication. That's okay too. Usually it's kind of better to have some rapport first, but people are really open to talking online now, and that's great too. In a clinical setting where we are sitting face to face, I would note nonverbal behaviors, right? Are you shaking your foot? Are you are you talking like this the whole time, right? When I rewatched my first lecture for this class, I was like, whoa, I was so lackluster in the way that I was talking, probably because I hadn't slept and I felt really bad for giving you kind of a really boring lecture. That's why I'm trying to avoid that and find better videos for you. Okay, so other things are, I had a client who did not blink once, just looked me directly in the eye like they were staring into my soul for 50 full minutes. And that is something that I would note too, right? Other things are they're very well kept, right? So there's not a single hair that is not gelled to the rest of their hair. Perfect, you know, no wrinkles or creases in their suits and they're wearing suits, right? Or is this person, kind of, they're very just letting it all go, right? So those are some things that I'd want to note as well. I'd want to know things like, what is your current mental status? Do you know where you are right now? So there's a lot of different ways, a lot of different behavioral observations that we need to note as well. Go through and check a client's behavior and functioning in a number of these spheres. So these spheres are appearance, attitudes, behaviors, mood, affect, speech, thought process, content of thought, perception, cognition, insight, judgment. I'll talk about a few of them with you. So we already talked about appearance. Attitudes is another thing. So attitude actually has to do with your belief towards a specific idea, whether it's therapy or not, right? Whether it has to do with seeking treatment. It could even be towards uh, like a very strong political stance. It could be towards relationships in general, right? Those are attitudes that we're looking at too. Behaviors, we talked about that. Mood and affect. So mood, it's very much related to feelings, but it's not quite feelings. We'll talk about more of moods when we get to mood disorders. Affect has to do with the ability that you're expressing your emotions. So just by listening to my voice, right? Listen to my voice and tell me if this is something that makes sense. Yes, I'm really excited today. Today was the best day of the week. I had my favorite food, which was pizza, and yeah, this has just been the best day I've had in a very long time. That doesn't really give you a good idea of me having congruent affect, right? Because what I'm saying is I am really excited, and it might be true for some clients, right? There are a lot of medications out there, a lot of psychoactive medications out there that diminish your ability to show your affect. That doesn't mean that they're lying. It just means that they are probably having the best day of their week, but they don't have the ability to express it through affect, right? It could also be like, yeah, today was really, really bad. And it was really, really bad because I just saw my dog, which was my best friend ever, just passed. And that is also incongruent affect, right? So they can't slow down to tell you to express their true mood at that moment. Okay, so speech is another thing. I expressed affect using speech. So that's another way of um, that's another example of speech, but there's many different types of things to look for in speech as well. Again, referring back to my very first lecture where I was talking a lot more slowly, you could probably tell that, or if you don't know me, which you probably don't, if you haven't had me in another class, you probably know that that's not how I really am. I was just really tired that day, so I thought I was being exciting. Listening back to it, I was like, okay, this is really not that great. Okay, so thought processes, right? So this is really important because we'll talk a little bit more about this in different types of treatments, but if if I told you something like, not me, I would never tell you something like this, but if somebody told you, gosh, you're such a dummy, like such a, terrible person, you're such an idiot or something like that, right? Excuse me. And you're like, it's I don't believe it. That was just like one time. It's not that big of a deal. That's a great way of dealing with that. However, if you yourself are consistently saying, oh, I'm such an idiot. Why did I make that careless mistake? Why didn't I read through the instructions more carefully, right? So I'm putting myself in perspective of what you might be going through as a college student. And if you consistently say things like that, it makes it so that you start to believe some of that. So it's really important for me to hear your thought process, right? And that's just part of it. All of these, I'm only briefly giving you a small example. There's lots of different examples. Content of thought, right? So this is what you're actually thinking, not just your process, but what it is that you're thinking, right? If you're thinking something like, COVID isn't real, right? So that's the content. And then if you go through and tell me why you think COVID isn't real, that's the thought process, right? COVID is real, by the way, just so you know. Um, Perception is another thing. What does it look like from your perspective, right? So what if you're talking to the client, why might they be viewing things in this type of a way? For example, I'll tell you about my own mom. Like I actually do have a pretty good relationship with her now, but she is very worried all the time. It's not for herself, but more so for her kids or her grandkid. But she'll tell me things like, don't rely on your friends, don't, and I don't live like anywhere near my parents. So if she, if she thinks that I'm hanging out with friends too much or something like that, or she'll say, no, you can't trust anybody, because for her, her oldest brother was actually murdered by his so-called best friend, and she went through a very traumatic experience where her family, very, very poor, just had immigrated over from a refugee camp, and this was maybe like 35 years ago, and they got word that my uncle had been shot and killed, and even though the mortuary in Thailand had his body and had known the contact information, they held onto his body for a whole month because that then they could charge my mom's family much more for um, preserving him and holding on to him. So that was very traumatic for her, and I get why she doesn't believe in trusting others because that's her perception of what she thinks friends do, right? So um, moving on, cognition, right? So this is all mental processes. So remembering, thinking, um, problem solving, all language, that's all part of cognition, and we're going to assess that as well. Insight, do you know why you're here? You know you make bad decisions, you know whatever it is, or do you not have any clue at all? You're here because, again, somebody referred you in or said that you needed to come see me. And then judgment, right? So how are you making your decisions? So that is that is a mental status examination. The mini mental state examination, this is a quick way of doing the mental state examination. Sorry, I cannot speak right now. But that is, so this is usually you have somebody coming in from maybe an accident that they just had. This is a way to really assess for neurocognitive disorders. Maybe they are delirious, maybe it could be that they had a stroke or something, right? So we're really going in to see what the judgment, all those things that I mentioned in the last slide, over in this slide, but in a brief way. And there's standardized questions for us to go through in order to get through all of the things that we need to check, all the aspects we need to check for. And I'll show you that on the next slide. Just kidding. I'm not showing it to you on the next slide. This is intelligence testing, and I'm going to save this for another mini lecture if I think that there's not a good representation of this in your book. All right, so that was your mini unit. Thank you. I hope this was much better than that first video that you watched. Okay.